City. Welcome to the first ever episode of NYC Let's Talk COVID. I'm your host, Matt Richards, and I'll be here to get you everything you need and want to know about COVID-19 directly from the city's top experts. Today, I'll be Zooming with Dr. Jay Varma talking all about COVID-19 testing. He's the Senior Advisor for Public Health at the Office of the Mayor. Now, I got a lot of questions, so I hope he's ready. Before we get to that, let's start with this week's COVID Need to Know. The vaccine is here, New York. After almost a year of hoping and praying for something, we finally got a vaccine. There is a light at the end of the tunnel. This thing has been tested. Thousands of people have already taken it. It's safe, it works, it's 95% effective. 95, that's an A, right? That's passing. You're an honor roll student. Take that thing. Now look, we all got crazy people on social media. I blocked most of them after the civil unrest of the spring. But there's still a couple ones that slip through the cracks, okay? And they're like, look, the pandemic is over. No, it's not. It's not by a long shot. But we can get through this if you keep washing your hands, keep wearing your mask, and keep social distancing. It's not that hard. It's not hard. All right, New York City, my first ever guest, the one and only Dr. Jay Varma. Dr. Jay, how you feeling, man?
It's great to be here today.
Likewise, fantastic. I got some questions for you. We're gonna get to the nitty gritty of what's going on with COVID in the city.
Okay. Yeah. No. So an important part of my job here at the city is to try to get information to the people that need to know it. Some of that information is what I'm sharing with our city leadership, the mayor, the rest of the leadership team across all the city agencies. But a lot of that work is communicating to the public. The only way that we can really continue to fight back against this epidemic is to have information that we can use. So the more that we can empower people by understanding the science of this disease and what we can do, the better off we are.
That sounds good to me. Let's get into it. Where do I go to get tested?
So one of the best parts about New York City as it relates to COVID is that we have testing sites all over the city. Now, of course, we have a healthcare system that includes both private providers as well as people that are funded by the city. So there's really lots and lots of options. The ones that we certainly recommend people try are the ones that you can find through the New York City Test and Trace Score. We have sites really all over the city that you can find on our website, and they really provide every type of service you might want. Some people want to get a test result that's provided right on the spot, what we call a rapid test. We have mobile testing vans, we have physical sites that provide that. We also provide the other type of test, which is really the most accurate version of a test, called the PCR test, and those are also available at all of our sites. So the most important thing you can do is to check the New York City Test and Trace Score website, and it'll list all of the different places that are in and around your community that you can go to for a test.
Now, question for you. Do I need to bring insurance or money or ID to get tested?
So the best part about our city services, in addition to the high quality that you'll get, is the fact that these services are available to all New Yorkers, regardless of your ability to pay, regardless of your immigration status. Now, two important caveats. We are required by law to collect information about your insurance status so that if you have insurance and they pay for it, we can recover that cost. But if your insurance doesn't cover it, or you don't have insurance, or you're not able to provide the information, you'll still get the same service as everybody else. The other fact that's important to keep in mind is we do need to see some form of identification. And the reason that is, we need to make sure you are who you say you are, so that when we give you the lab result, it's connected to you. Now, it doesn't have to have anything about your immigration status or anything else. It simply just needs to verify who you are and what your birthday is, so we can link you to the test result. One of the things that everybody should do when they go to a test site, there are a couple of things you should always have with you. In addition to having your ID, any insurance information, if you have it and you're able to provide it, is to bring with you a face mask. All of our sites work really hard to make sure that people stay spaced away from each other. But as we know, the other critical way to prevent this infection is to not just keep your distance, but to have a face cover on at all times. And of course, our sites are also going to enforce that as well. So please bring one and wear one at all times. If for some reason you don't have it when you show up, somebody will offer you one and you will be expected to wear it.
How often should a person get tested?
Yeah, so we have information on our website that can help guide you depending on your own risk. If you work in like a nursing home or in a place where you're at very high risk for getting COVID, we actually recommend you get tested very frequently. In our nursing homes, for example, people get tested every week. For the average New Yorker who is out and about and meeting with other people either because of work or social situations, we say once a month. What I do personally is usually it's about every 3 weeks.
Okay. Why do I need to get tested if I feel fine?
So one of the things that we learned about this virus that really changed how we managed it was that we found out that people can have this infection and not know it. Some of them may have symptoms that develop later, but some people may never get symptoms at all. Now, the problem is, even if you have the infection and don't have any symptoms, you can still transmit it to other people. So the reason we recommend people get tested and get tested frequently is to catch those situations where you may have been infected, but you don't have the symptoms to make you think you're sick.
Where you stand, so you're not spreading your virus all willy-nilly. Now that I got Dr. Varma all warmed up, let's take it to our correspondents, the dynamic duo, Lita and Millie, because they're out talking to real New Yorkers to find out what else they want to know.
Hey, it's your girl Lita, back on the streets of New York with NYC Let's Talk COVID. Hey Leslie, if you could ask our panel of experts any question, let's go for it. What do you have?
So my question is, I was maybe exposed, possible exposure 2 days ago on Wednesday. It's now Friday. Some people have told me I'm getting tested too early. Is it good that I'm getting tested today?
That's a great question.
Yeah, so one of the things that's challenging about this virus is that if you expose me today, let's say you cough on me and I'm at risk of now getting COVID.
That's rude. That's so rude.
Yeah, exactly. Well, that's the upside to using Zoom, right? Is that we don't have to worry about that. Thankfully, the computer doesn't spread any viruses. But let's say, for example,
the ones I get from the websites I'm not supposed to be on.
Exactly. Yeah, you may not want to be surfing some places. Let's put it that way. So with this infection, if this virus, if I'm exposed today, it can take up to 14 days, up to 2 weeks until my body reacts and actually shows any evidence that I have that infection. Now, that is the extreme example. For most people, you're going to find out, or you're going to develop symptoms, if you do, probably about 5 or 6 days after that exposure. So if I get coughed on today by somebody that's got COVID, usually in most situations, 5 or 6 days later, I would show a positive test result. It can be a little bit earlier than that. It can be around 3 or 4 days, but on average, we say it's about 5 or 6 days.
Oh, wow. Okay, so if anybody was outside 6 days ago and you feel symptoms, make sure you go get tested.
I was telling somebody the other day, this is like the final Avengers movie, okay?
Oh, man.
You've been fighting off for the past couple of, for episode after episode of that series, and now we're in the final end game.
Which Avenger are you?
I guess I can either be Doctor Strange or Iron Man, depending on the outcome.
I think I would be, I'd probably be the Black Panther, I guess, by default. I don't have the abs for it. Millie, hit me with a rumor.
I'm Millie Tamares, and this is NYC Let's Talk COVID. Hi, Adrian. How are you?
I'm good. How are you?
Good. Okay, so let's talk COVID.
Okay.
Adrian, what is the weirdest, strangest rumor you've heard about COVID-19?
I don't know how much you can believe it, but it's like coronavirus isn't actually coronavirus. It's actually radiation poisoning from 5G phone towers.
Interesting. So 3G is cool, 4G is cool, 5G is where you start getting problems.
Yeah, I guess 4G is pushing it, but 5G is where you really start getting sick.
True or false?
That is completely false. This is one of the things that's hard about this is it's something is hurting us that you can't see. And that is confusing to all of us. And it makes us want to grasp and look at explanations that seem more real to us. I can understand it. People see a cell phone tower. It looks unusual or strange to them. Maybe that's actually what's making me sick. It turns out it really is a virus. And these viruses live in animals, particularly things like bats. And I've spent my career actually fighting these diseases all over the world. And so it's important for people to understand that there are thousands, tens of thousands of people around the world who have been working on this type of problem. And we can really reassure you with all of the expertise that we have that this disease is caused by a virus, and the things that we're recommending to prevent and to stay safe are the right things that you can do to protect yourself.
Now, am I good to go after I get my results?
So the most important thing to remember is that your test results are just like a snapshot. They're one point in time. The solution to all of our problems is for people to wear a mask, keep your distance from other people, limit your gatherings, wash your hands, and as it becomes available, get vaccinated. Testing is just one added piece to that, because the sad fact is, the moment you walk out of that testing site, if you walk, into a big gathering somewhere indoors, you could get infected right then and there, and then your test result doesn't mean anything. So it's a good snapshot in time, something we want people to do, but it doesn't give you a shield to go out and do anything you want.
How accurate are the test results?
One of the things that we've done here in New York City is we don't offer a test unless we know for sure that it can give you accurate results. So even if you're getting one of the rapid tests, which we know don't catch everybody, if you get a negative test, that means it says that you don't have it, we actually do a backup with a second test just to make sure we're not missing anything that you have.
Okay. Now, what are the different types of tests? I know we talked about it briefly, but I just want everybody watching to know the different types of tests that are available to them.
Yeah. So the first thing I want to make sure people understand is that there are blood tests that we use that are called antibody tests. And there are tests that we do usually of your nose, sometimes of your saliva, that we call molecular or PCR tests. So the first thing I want to clarify is that the test that you have on your blood, the antibody tests, they don't tell you if you're infected right now or not. They can tell you whether or not you might have been exposed and infected in the virus in the past, but they don't tell you anything about your status right now, whether or not you're infectious to other people. So the tests where you have something, a swab put in the front of your nose, or if you give a saliva specimen, those are tests to see if you're infected right now.
Okay. Well, last question.
Is it okay for people to wear bandanas as opposed to a mask?
One thing we have learned is that bandanas probably aren't as effective as other cloth face coverings. The reason for that is the cloth tends to be kind of thin, and it also tends to flap over your bottom of your mouth. So we really prefer masks that have some type of ear loop, something that can really kind of hold it close to your face. That appears from what we know to exactly.
Okay. Well, that's great information, Doc. Thank you so much for joining me today. I appreciate you and everything you and your folks are doing out there to keep New Yorkers safe.
Great. I really appreciate the time to talk to you. It's been really fun, and hopefully it's been helpful to people.
Yes. Yes, it has. Thank you so much for joining us for our very first episode. I had a great time talking to our expert, Dr. Varma. Shout out to Dr. V. Thank you so much for joining us. Thank you guys for watching. Guys and gals at home or wherever you are, you could have been doing anything, like reading all those books you ordered off Amazon that you've been putting off all quarantine. You'll get to them. Thank you to our correspondents, Lita and Millie, for being out there in the street talking to New Yorkers in a global pandemic. Make sure you tune in next time where we're talking to Dr. Varma again about all kinds of things like dating and socializing and sex. I'm Matt Richards, and you've been watching NYC Let's Talk COVID.